Hello, everyone, and welcome to another session of Stroke Awareness. The session, in collaboration with Boehringer Ingelheim and Integrated Health and Wellbeing Council, is to understand and diagnose stroke early. We are collaborating with the experts from the country, and we'll be talking to Dr. Sandeep Gill today. So, my first question for you is that how Punjab and what improvements are needed to enhance the patient outcomes when we look at stroke care?
In Punjab, we are very concerned. We have the spread awareness. We do a lot of awareness activities, in Punjab for stroke management. And we had done, in fact, Boehringer had been also helpful us for making capacity building of our healthcare teams, doctors in the emergency, paramedics in the emergency department. They had done it during the COVID time, and it's continued, now also. One is the major thing is that we are providing, free thrombolytics, to the patients. We have created, now earlier there were 9 stroke ready units, 3 in the medical college and 6 in the district hospitals. Now we have spread it to all the district hospitals, and early intervention, by way of early diagnosis and making the right referral and making the reach, to the patient, so that the timely treatment can be started, So this is how we have started, and now we are also like, sensitizing people about hypertension also, because we are running, a side-by-side preventive side also. We have IHCI, India Hypertension Control Initiative, running in the street, which is doing a lot of prevention, part, because with controlled hypertension, we have we reduce the bad outcomes, stroke as well as the STEMI, So this is major, awareness activity and preventive side of things which are doing. We celebrate Stroke Day, and there we also create awareness, Then I was talking about providing free thrombolytics, at the district, for all the patients who are diagnosed. In fact, for that, the funding is through the Ayushman Bharat, insurance scheme. People, almost 70% population is covered by that, and through the state department also, we are doing funding, for purchase of these thrombolytic drugs. And then one of the good initiative is like, the 108 ambulance, people call 108 and then the patient is shifted immediately, like, to the nearest, My concern remains still, for right referral, which I'll talk later maybe, and then timely assess is made so by the ambulance, and this is a major thing. So these are some of the about the diagnosis also. We in 2021 we started, because for us diagnosis we need a CT scan. We started a PPP mode initiative, like, where all the district heads, the civil surgeons, CMOs, were asked to make a arrangement with the local CT scan centers in the district. So they would do an agreement, and then they would be paid, free for the CT scan services. And they were agreement in that way, the priority would be given to our patient, referred from the emergency, and immediate, provisional diagnosis would be sent. We have to understand whether the patient is ischemic, having ischemic stroke, or it's having a hemorrhagic stroke. So before CT, we cannot proceed for the thrombolysis. So this is one of the major initiatives. So likewise, we have done quite a things, in the stroke management in the state.
Thank you so much, sir, for your insights. And it was actually insightful to understand about how the work is being done about 108 ambulance, and also how the government is looking into the details of stroke care, different phases of stroke care. So,
Hmm.
how does this differentiate when we go to the undeserved communities? How does it go when we're in the rural region? How is the awareness of stroke there, and how can government collaborate with different stakeholders to enhance the awareness of stroke in those communities?
Right, this is a right question, because 70% of population lives in the rural areas. So making outreach to the underdeserved, underprivileged people, is very important because they don't have money for CT scan, or so making these diagnoses tools and then drugs, as I already told, So we have PM Ayushman Bharat PMJ insurance, scheme which covers these people, as well as once the patient, comes to the hospital, all the treatment is free, like, even in the government setup. So this is one. Then we ask our, through the IEC also, we make a lot of, awareness activities, on the FM radio and like, through our CHOs, community health officers. We sensitize our staff in the field, like, that stroke program, all this is available. So this information reaches to the underdeserved, people also. So that's the outreach we make.
And so, how about the collaborations in with the healthcare advocacy organizations? How can the government collaborate there, and how can we make these collaborations more successful to improve stroke care?
Like, yeah, of course, role of NGOs and other civil society organizations is very important, for, like, to create awareness in the communities, for early diagnosis, for, I mean, understanding the early symptoms of a stroke patient, So if we make awareness, these NGOs or these organizations, they reach out, and, like, in urban area, if they can reach out a health camp in what do you call RWAs, resident welfare associations of the local community in the urban setup, or through the panchayat and Jila Parishad, the make a reach out to those, by a way of organizing camps, So health camps can be very helpful, and they do also, like, and I mean, I have been also attending many health camps, and when I was posted in the field, So then, by way of making awareness about ambulance service also, and then making awareness for not falling prey to quacks. This is very important, this organization can play a very important, because it's a very common, like, in the rural setup especially, people think that opium is a drug which helps in heart attack and stroke. It's a wonder medicine. This is practice I've seen in Punjab. They take bit of opium once a patient is given, I mean, patient is given opium if he's having a stroke or similar symptoms, and or a MI. So these awareness activities has to be very important, So that's my suggestion, and it's happening also.
Thank you so much, sir, for sharing the regional insights about stroke care when it comes to the state of Punjab. So, when we look at stroke, there's a pre-stroke phase where the lot of reasons for manifestation of stroke come into play, and there's a phase where the patient is undergoing stroke, and then comes the treatment, the golden hour where we need to provide the treatment, and then comes when the rehabilitation phase. So if you look at these four critical phases of stroke to occur and occurring, and then the rehabilitation phase, what kind of work is being done in the state of Punjab for rehabilitation and stroke care?
See, as of now, the preventive part I already shared, the
Yes.
hypertension remains of, and we are also doing a lot of, awareness amongst the school children, for NCDs, the WHO program, PEN program, we are doing a lot of, not only for NCDs, other, especially the mental health program. Also, we are doing, awareness amongst the school children, We are sensitizing our doctors under RBSK program for that. And prevention, and then the pre stroke management, that is being taken care, because we have already sensitized our field staff, our multi-purpose health workers and our community health officers in these centers in the field, sub centers and health and wellness centers. that they make outreach, for that. For the treatment part, we have already made capacity building of at the district hospital, especially even at the sub-divisional hospitals, we have done good. And this capacity building is an ongoing activity. We are doing, good for the in the primary healthcare doctors are being also sensitized that we decentralize at the district headquarter level, like, to make further, training programs. uh, yes, from the patient that need time to reach needle time, what we call, like, it's very important. The right referral is very important. Sometimes, this because of the lack of awareness to which center the patient has to go, makes a lot of loss of time. And the in stroke, in seconds, the millions of neurons are dying. So that awareness we are creating, for our paramedics and doctors. Treatment part, thrombolytics we have provided as of now at a district hospital. So whatever we are doing is like, information should be there in the field. So nearest, at least they should reach to the hospital. Where I'm emphasizing the right referral is, like, if the district hospital is 60 kilometers, but you have a nearby medical college, then it has to be to the medical college, not to the district hospital. So that sort of awareness we are also creating for the right referral. And your question is about the post stroke management. That is very important because at present the rehab part is a little lacking. Though in the district hospital we have physiotherapy center established under the elderly program. We have a national program for healthcare of elderly, which I was also looking early, at that program. And in that program, the outreach is now going to be at the CHC level, community health center level. So we are going to establish physiotherapy center at the CHC level. The vision is to make a domiciliary approach, like, to make outreach to the patient who cannot commute, from their homes in the rural setup to the healthcare center for a physiotherapy. So we have to train our paramedics, and though there is a shortage of staff, we have to train them to make with the basic understanding, with the basic understanding, so that the patient who is bedridden now, suppose he's had a stroke and he's bedridden, he should not have bed sores. His mobility should be there. He should not have difficulties. He's taught to know how to have how to make patient have his meal so that there is no dysphagia, or there is no obstruction in the taking the food, or there is no that leads to pneumonia. I mean, if there is any management of that food and drink intake of the patient. So the things like that we are also telling them. As of now, the rehab part is at the district level, but we are taking it down to the community health center level, and the final will be like, the outreach by our healthcare worker. They're doing, many of the places they're doing, some of the district they're already doing. The community health officer is going to these patients and guiding the families. And a family suffers equally more when there is a patient of stroke, because one person is confined with the patient itself when the patient is bedridden. So this what we call disease adjusted life years, so this is important, for us to take stroke very seriously, like, and we are taking it.
Thank you so much, sir, for sharing your insights today. Before we conclude, I do see that there are some challenges in the state of Punjab, but in comparison to several other states, it's very well equipped and it's doing really well. Uh, while we have covered a lot of insights about infrastructure as well, there's one point where you mentioned that reaching out to the nearest hospital than reaching out to a district hospital, but also the availability of stroke care. What is the status of infrastructure when we look at the stroke care infrastructure? How equipped our regional hospitals or say medical colleges to actually deal with stroke care?
Yeah,
Yes.
at the district hospital level, the staff is trained. In the sub-divisional hospitals, also we have medical specialists, and the emergency team, the doctor, EMO, they are all trained, for taking, stroke patients seriously with, and they understand, like, all the early symptoms, when the patient arrives there, the drugs are there, they understand the right referral also. So, but at the primary healthcare level, the still work is being done, like, and we are making a lot of capacity building of our field staff, So creating more knowledge, because many times, sometimes, especially the field staff, sometimes they wouldn't understand at some point, and there's a lack of knowledge at that level, So then already right referral, although it's been guided and informed, and they are taught, for that, but sometimes it happens, like, this remains still a challenge, that patient is referred to another center, then time is lost, we have the one of the major challenges was early diagnosis, which I think at the district headquarters it's done. At the sub-divisional level, it's going to be up. Many of the Punjab is almost semi-urbanized. Many of the sub-divisional hospital level places, they also having now CT scan centers. Now, good initiative by Punjab government is there is a Krishna Diagnostic. We have made a PPP mode collaboration with them, and they have established an CT scan center in all the district, and in fact, the lab services also, which are at a very subsidized rate. Now, the department is in process of making a MOU with this for providing at that same subsidized rate. We will be funding from the department to for that CT scan for the stroke program. For any patient who will be coming, as already done in some of the districts, the 2021 onwards for the PPP mode, like, but now we're going to do holistically all districts. It will be a consolidated MOU with the Krishna Labs. So this will provide an early diagnosis, free of cost. And just EMO has to sign the emergency slip and send the patient, and this patient will be on priority taken care. So capacity of the EMOs, it's an ongoing process. It'll have to be again and again keep on, because they get transferred out. The people come in, so this will be ongoing thing. There's a little shortage of staff. Definitely in Punjab we are short of doctors and paramedics also. That remains a challenge. One of the challenge. And of course there are certain challenges in the ambulance services also, but that is being improved upon. I suggested one of the initiatives, that we create an app. I was in talk with Professor Khurana at PGI and Dr. Pandian at CMC Ludhiana. So creating an app for where the patient, can, like an Uber app or a Ola app, we can monitor a 108 ambulance when it is reaching us. So the patient is, like, is comfortable that in so much time ambulance is going to make it. Otherwise, what they do, they would try their own transportation, like, some local arrangement they'll try to make. But this is one of the things I suggested. This bridging the time, from the home to the hospital. This is still a challenge. We are working on that.
Thank you so much, sir, for your insights today. I think it was a great session. Learning about the work being done in stroke care in Punjab is truly inspiring. As we conclude, I request you to kindly give your conclusion remarks.
So, stroke is a very important. This, I'll just say, not say the disease. It's an important concern, healthcare concern, and it's the root cause is hypertension mostly. And since we are already working on it, the department is working very strongly for management of the hypertension. Punjab is in the top states where we have a high prevalence of hypertension. We have almost 35%, 34, 35% of that makes every third person hypertensive in the state. This because of the dietary habits we have in the state, high fat, high salt, high sugar diet we take, high. So this all awareness we are creating, to abstain or decrease alcohol intake, and refrain from smoking. These are one of the two major causes for causing hypertension. So for the stroke, we my uh, advice, or I'll say a suggestion will be that people need to be aware about the early symptoms and the early diagnosis, and not fall prey to local quacks. That they say there's some goose come in who is this some Hawa and all that. They consider local people's version of making. So anyway, so awareness is very important. Awareness among the school children is very important because they carry message home very loud and clear, and they guide the families. So we're working on that. And since we are already doing good by providing free thrombolytic drugs and free diagnostics, so we are looking, and the recent initiative by the health department is that we have started a collaboration with CMC for mechanical thrombectomy also in the state. So MOU has been signed. So all those patients who will be needing some sort of major surgery by way of intervention of MT, so that will be also taken care. So I, my emphasis will again remain on the preventive side, make awareness about the diet and early symptoms. So that's it.
Thank you so much, sir. Thank you so much once again for the insights you've shared today. Thank you again for your valuable time. Thank you.